everyone. Welcome to the new Systemic Lives podcast. Sometimes with me, Sheila Rashid, and sometimes with Gail Simon. We have the pleasure of talking with some leading international and national systemic contributors about their lives, loves, and what brought them to systemic practice. Do watch on YouTube or listen on your favorite podcast feed. Hosted by Murmurations, Journal of Transformative Systemic Practice at systemiclives.com.
What is Lorenzhuis? Can you say a little bit about that? What it is, what it was, what you envisaged when you started it?
Well, I started it because I also got fed up with big institutions. That I had an idea and it always had to be written down, and then it went there and then it went there. It always lasts a long time before something could happen or it couldn't. And it was also difficult with money always. And I felt like there was a break on everything that I wanted to do. And that, so, and also, there was also another very important thing. The biological wave came in.
Oh.
And a lot of pharmacy and so there was a backlash from all the ideas about possibilities and growth, and there were sensitivity trainings, and that also in psychiatry, a lot of the anti-psychiatry, critical psychiatry that I was part of, and that I really was a big resource for me, but there was a backlash. So then the biological psychiatry came back, say this is all rubbish, that's not real psychiatry. Psychiatry is a medical profession, and we need to see the psychiatric illnesses as a biological illnesses, and we need the good pills and things like that. I got fed up with that. So my position was also reduced. I felt that I got less space instead of more. And I thought this is not the way I want it to be. So we need to create something new. And that, I think that turned out to be a very good idea. And then from the beginning on, not only to do systemic therapy, but also to do the training of systemic therapies and to get registered as trainers and supervisors. So we grew. It was started small. It grew. We had some difficult times.
Who was the we? What was the building? Because I've always imagined, because I haven't been to Lorenzhuis. But where is it? Which town is it in? What does it look like? Is it an apartment or a house or a office? What is it?
Well, that changed, of course. So we started in the house of Leo van Dijk, who was the co-founder. We started the two of us. He used to be a cardiologist, but he got fed up with the whole medical system. Then, when he was 50, he did the training as a psychiatrist. And then he became very enthusiastic about systemic thinking, about family therapy. And then he wanted to create, I think his dream was a kind of Ackerman Institute in the Netherlands. And he invited me, and we started in his house in 2 rooms. And that's where we started. But we also started with training there. And we started to train because we had big rooms. And then two other joined us. We had to also, and then I said, I need women in the team. And then we invited other people. And actually, it's still the same that people can say we are interested to become part of the Lorenzhuis team, but we can also invite people to be part of the team. It's that way. And then it's important that we all are private. It's all private practice under one roof.
So what does that mean in practice? You know, I'm thinking from an English or British context. that we have a national health service, and sometimes people working in private practice or independent practice, it can sometimes have bad press, as though it's all about money, which I think is a terrible misunderstanding as somebody who's worked in independent and third sector organizations, independent organizations, private practice. From my point of view, it creates more freedoms, a different culture. You can offer a service to people who wouldn't otherwise get the help they needed through the NHS, through institutional boxed thinking. So what happened with Lorenzhuis? What was it doing? How did it get funded? How did it create the freedom to respond to community need?
Whatever. Yeah, that's what we wanted, to respond to community need.
Yeah.
To respond to needs, yeah. And, well, in the Netherlands, it was very well possible to do everything through insurance companies.
Right.
So everybody who had insurance, nearly everybody has. Maybe one or two refugees do not have, but most people have insurance and for health insurance. And we were recognized because we, most of us were also psychiatrists, psychologists. And we could also, the social workers that were, or drama therapists, could work under our supervision. We didn't do that really, but then the insurance company said, okay, then we pay them. And we made sure that everybody was paid the same.
Whether they were a psychiatrist, or
that there was no difference in income. That was very important for us. And also that we said, if you want to work in the Lorenzhuis, you have private practice, so you can take your holidays when you want to have your holidays. The management is done all the time by two people, one for the finances, one for the rest. And they can call for a meeting with all of us. But that changes. So you have to do it for 2 years and then somebody else comes in. So there was actually not a real hierarchy. There was no director, never was. I didn't want to be a director. So, and it's still that way.
It's still that way, 2025. It sounds as though, I don't know whether these were values that you carried through from your days in the commune, and those politics, whether you've lived them consistently or they were good for that context, or whether this is something to do with Nederlandish culture.
I'm afraid not, because we are still an exception.
Okay.
So there are colleagues that say we want a Lorenzhuis, kind of Lorenzhuis, there or there or there. But most of the time they end up, no, not all of them, but most of the time they end up being institutionalized, because money-wise it becomes very difficult. And we have a lot, so money-wise it's more difficult now, because the insurance companies are pushing to make an institution also of the Lorenzhuis all the time.
What do you mean, make an institution of the Lorenzhuis?
That they say you cannot make it with the insurance companies this way. You have to make an organization.
Right.
And you have to say, we need so much money for this year, and then you have to see how you. But the way we do it all that time, so now we have a lot of things going that the people have to pay us, and they can ask the insurance company
to be paid. That's very different, isn't it?
And the sad thing is that we always wanted to be there for everybody, and we still can. But then when people have to pay us, they need some money. But what you can do is say, like, I know colleagues do that, these people can only pay like £10. Okay, then we do it for that. And they are from a rich neighborhood, a rich family. They pay much more, and to try to do it that way.
Mm-hmm.
But it's more of a struggle. When we started, it was much better. And then what also was important in Lorenzhuis, we didn't want to have a difference between youth care, adult care, elderly care, because we said it's systemic care. So all the generations together. And that was very well possible in the beginning. And now it's also more difficult because the youth care is paid, it has a totally different financial organization, paid by community, adult care by insurance companies or people themselves. And so in the healthcare, they made this split between being a child, being a youth, being adult, being elderly. It's stupid.
It's a systemic story of it being a struggle to be systemic in a context which is so splintered.
Yeah.
And
fragmented.
Yeah. Mm. And then you have to find new ways of responding.
Yeah. But if you are a training center, then you get money from the trainings as well. That's important, of course. So, and we give consultations, and we are invited to do consultations and to do also not only trainings in the Lorenzhuis, but in other institutions. And then what I love very much, that students from us now made a new child psychiatry in Haarlem, for instance. And it's a great initiative that's getting a lot of recognition, where they also start with the whole thing. And so there are young psychiatrists that's easier if you're a psychiatrist to start a child psychiatry center. But they work with all kinds of therapists, and they do a very good job.
How has the Lorenzhuis changed over time in terms of the work it does?
In terms of?
The kind of work it does. I was thinking about some of the work you've done with families around violence and separation and so on.
I think a lot is still, the soul of the Lorenzhuis is still the same. Is still there. I'm very happy about that, because I stopped working there. And I'm in contact. I can ask for a consultation, but I'm not in the center anymore. And I wanted to step back. And because you need to step back in order to make the next generations active and central. And it's really happening. It's and the soul is still there. So a lot of things are the same, and we always wanted to be relevant for the community around. And that when violence became more and more in our attention, we worked with violence in families. I was central there. We worked with high conflict divorce, because that was a big problem. But we also worked with, there was the mobile Lawrence project, because so many families got stuck in care and still had a lot of problems. And we wanted to find out what is it and can we do something there. We went to the families. So that was mobile Lawrence to go there. Mm-hmm. And it was a helpful project. And now I know they have, they had a very important project and groups around nonviolent resistance. And also two of my colleagues gave a lot of trainings there. So we start projects when we feel there is a need, and we can notice that because so many referrals are around that problem. I know now they have a lot about also the very newborn children and the young families, and the young parents suffering, and babies that do not want to eat, to sleep, and things like that. And they also do the group work and bring parents together. And so also new projects start, but it's still the same way. a lot of things didn't change, and I'm happy about that. And they always have intervision groups. You have to be there. You have to take that serious. You cannot say, I want to have private practice in the Lorenzhuis, use everything, but I'm not doing the things we do together.
And you talk about intervision rather than supervision.
Intervision. We always call it intervision. You come together, you have dialogues around cases, around something else you want to bring in, and we just have dialogues around it, and it's very helpful.
One of the critiques around collectives or groups where there is not hierarchy is that sometimes when it comes to critical decisions, people, there is a hierarchy with somebody saying, right, you have to do this. This is where you have to contact child protection services, for example. And I just sort of wondered how that played out over time.
It will never happen.
What will never happen?
Somebody saying to somebody else, you have to contact.
But what if no, that's fair enough. But I was thinking more, what happens if somebody thinks there's a risk and the person working with the family or the group doesn't see the risk? How would that be managed? Because these are important questions. Certainly I'm thinking about, or some of our of the people who are joining us by listening or watching this will be in a situation where those decisions are always made for them by a policy, by a manager, or they are the manager, where they have to say, now you have to do this. So it's hard for people to have always the experience of working collectively without a power higher than.
The responsibility is in the collective. So if because there are more complaints now, maybe also here formal complaints from clients that are not satisfied, or in this high conflict divorce area you have complaints, blah. When one of the Lorenzhuis has a complaint, we all have it. We all have to think together how to manage that, because it's taking your sleep, it's taking a lot of time, it's very stressful, so we have to support each other. And also the other way around, when I would think, when somebody is bringing in a case and I think, well, maybe maybe it's useful to contact child protection, I would just say, did you think of contacting child protection? And then we have dialogues around it. I never have had the experience somebody told me or told somebody else, you have to do that now. And no, it's not happening. It's, for me, what we do is, what we did is to have reflecting team. So maybe when there were a lot of worries around a family, or somebody really said, I'm getting stuck here, that we did a reflecting team. The family was invited, not with a screen. Some of the team members are in the room, thinking with the family, with the therapist. We did that. It's very easy in the Lorenzhuis to ask for a consultation of a team member. Say, can you please come with me? And you just had to say to the couple or the family, I'm not sure that we're on the right way, and I want to invite a colleague to think with us. That was very easy.
Just staying with this problem of referring on to statutory services, a lot of people these days are governed by policy, and they err on the side of caution. And there's a lot to be said for that. They may think, it's safer for us as professionals that we make that referral to child protection rather than stay in a therapeutic space and take some degree of risk, but still allow the members of the public, service users, their own authority to just hold things and keep working on things and hold the risk. And that's, I think, probably decreasing now, because people feel the policies are so clear, the complaints are so high, that people are more likely to err on the side of caution. a bit like the signage one comes across in the street. Be careful when you cross the road. If there's not a sign there, you could be sued if somebody then gets hurt. So how do you think that's played out in Lorenzhuis culture over time, erring on the side of caution to do the right thing by kind of policies, external policies and social expectations, and how much to just stay with understanding and taking the relationship, the therapeutic relationship.
But also notice the risks together. Because there are risks sometimes. There are risks for children, there are risks for women, there are risks for men, there are risks. Also with the very violent adolescents, for the parents, there can be a real risk. So I hope I can ask this question to my young colleagues. There are new young colleagues in the team, makes me very happy. Because I'm on an age that I really have to give over to them, to let go. But I can ask them, but I suppose it's still the same, that you take the risks together as a community. You're not on your own. You're never on your own in Lorenzhuis. No, I don't. I think it's still the same. So if you have this risky feeling and you do not want to have to complain, and you think, well, then that will be brought into intervention. With this case, I feel the risk. What shall I do? Can you come with me to let's go together? And we made it always very, very important. This kind of So when Vicky Reynolds is talking about burnout, is more connected that you cannot work related to your values anymore. It's not about self-care, it's about organizational care, team care. It's not an individual thing, burnout. I agree. So I've not seen a burnout in the Lorenzhuis from 1984 on. Nobody got a burnout.
Let's leap to talking about your doctorate, your doctoral research into practices of hope. Is that all right to make that leap? Just for people who don't know and haven't read or heard about what you were interested in and why and how you did this, can you just say a little bit about that research and what it involved?
Yeah. So can you remember the first one? I decided to do the doctorate. That was then I was 68. I was in Bradhay because, I don't know, I think Robert said maybe that's also a good thing for you to go. And we talked about that. I thought, yeah, that's interesting.
This is Robert van Hennick.
Robert van Hennick, yeah. And then I went to Bradhay, and then I met people, and I thought this is really good. And then I thought maybe I can do such a doctorate, not because I'm interested in getting a title, I didn't need it, but because I need a structure to reflect, critical reflection, reading, study, and I'm always active. So when I do not have a structure, I don't do it, although I have the longing. And I thought maybe that's a good idea. So let's give it a try. And then I thought, because I thought, of course, I will do some research around a project from the Lorenzhuis. It seemed very obvious for me. So I thought I will do the latest project was about a high conflict divorce, No Kids in the Middle, it's called. And I thought that will be my research. And I explained about that and my ideas. And you said, are you sure you want to do that? Can you remember?
Vaguely.
And that was such an important question.
Why do you think I said that or asked that?
It was a very important question because it was kind of predictable to do that.
Mm-hmm.
And you wanted to give me the space to make it more, to reflect on it more, what I really wanted to do. And it was very helpful. So I came home totally confused, but also liberated.
Mm.
And it was, questions can be very important. It was just are you sure you want to do that? And I made the whole presentation about No Kids in the Middle and what kind of research I wanted to do about the keystones and things like that. So it was quite something. But then I came to another idea of, okay, what is really important for me in my life, in my work? And then I came to the concept hope and practices of hope, and it never left me. I thought, that's actually very central in my life. So I decided to do that, and that was not an easy choice because it is so broad, so incredibly broad. When you do a search around hope, you drown. But I'm really happy I did, and I also happy that I did take time to read, reflect, and then of course it structures you. It makes a perspective that you look at your life and your work from this point of view, from practices of hope. Of course, I know it's also a perspective. It's not all of it, but then I thought, changing my name was a practice of hope. All kind of things I did in my life. And then I found, studying it and thinking about reflecting, writing, I was very happy that I had 2 supervisors from another field, which was useful also to broaden it up, not to be only systemic. So I think,
You mean your research supervisors?
Yeah, my research supervisors, Alexis Wieden and Christina Schwabenland, were from New Leadership and Art and Performance. And so different but related fields. And I think, it was difficult to create time still then because I had a lot obligations and commitments in my life, but I made time, later more. And it was frustrating sometimes, but I wanted to do it. And also the research in itself became a practice of hope. So it all came, for me, it brought a lot together. Also the resistance is in it. That's important in my life, to resist injustice, to resist what doesn't feel good. And that became very much related to practices of hope, and also to be active, not only to think, not only language, but also do things with your whole body, with your whole life. And to that, so how I lived, I researched also my own attitude in life, I think, and what it brought forward. And then I realized, and I can remember Alexis really liking that piece that I said, this becoming creative from resistance through also hope, and how these practices of hope strengthen also the activities, is there in creating the Lorenzhuis, in the projects in the Lorenzhuis, in making a choice for these trainings, it's everywhere. And then I could, in my research, switch my perspective and see a lot of projects in the world that work in the same way, that are resisting injustice or something, that are creating something in activity, and make communities that also make a better future, try to make a better future, whatever.
Can you give an example or two of something that really struck you as a practice of hope while you were doing your research?
There are many. Maybe I like to talk about my colleague Hans Bom, who was a very important colleague for me. He was in training with us. We invited him to come into the Lorenzhuis. He said yes. And I think he's a wonderful and very creative colleague, and very committed, also seriously committed. And he got depressed because of the world, because of everything that was happening in the world, and to nature, because he's a nature man, he's a walker. And he got so depressed, and he questions everything we did in the Lorenzhuis and psychotherapy and the use of it, because he thought everything is going down the drain. And he was really heavily depressed. I could see it. And then I will not tell the whole story, he was able to create where he lived, where he looked out in the meadows. He was able to get 2 hectares of land and to create a hopeful practice how you can create a land in a way that it is good for the birds. They can have their nests there, that the water is in a good level for them, that all the herbs and the flowers are also in the field, that it's beautiful to look at, and that's very healthy. And also to make related vegetable gardens and herb garden and a flower garden, everything like that. And he managed, and now in a few years, it's such a beautiful piece of land. And he also, the depression fade away. It's away, totally away. So he's full of energy, full of creativity. And of course he knows this is just 2 hectares, but he is now very active in getting more to see where we can do it in the same way. And he created a community that worked there of people. And everybody that works there has this happy feeling after a day of working. So, and then we think maybe that's even better than going to therapy, or maybe also the talks we have there are important, but it's not this in a room doing a therapy setting.
I was going to ask you what you thought the relationship might be between, or the difference in offerings between systemic social constructionist narrative, dialogical talking therapy, and being outside in nature. Is that
I'm really now, I changed. I think maybe we are now in the time that all this talkative therapies in rooms will end, because we cannot pay for it anymore. It's too much. In the Netherlands, it's too much. 1 out of 7 children is now in therapy or getting a diagnosis, which for me is crazy. And then I think if we can create communities in practices of hope, it's a totally different way of healing, of working for a better life. But I think we will go there. I hope we will go there.
Do you think systemic therapy trainings will have to change to get us there?
Yeah, I think so. And it will go slowly. You cannot say, okay, now because there are very, very good things in systemic training and learning people to think in connections, in relations, in how everything is connected.
But it might not be the theory that change. I gave a talk a while ago at the AFT conference in the UK called The End of the Clinic.
Yeah.
For a number of reasons. People want to do online therapy, some people. They would rather be in a different space.
Yeah.
They like to outdoors. They don't want to come to a clinic on the hill. Then so many things going on that have changed.
I hope also in the future that we are open to it, because the outdoors for many people is very important, even if you're in a wheelchair. So it's not all about being able to walk and do all kinds of things, but it's more that the outside, the movements, your body, and to create communities to help each other instead of having this therapist helping me. So even less hierarchy and systemic thinking will be in the core of it, I think. And there are so many possibilities.
I like the story that you told about, or there are many stories that came out of your research. There was one about a musician in a burnt-out bus. Can you tell that story, what you saw?
Yeah, that was a Dutch musician who was getting very famous, a very good musician and a composer and playing in different instruments, but he felt not really satisfied. As a child, he always wanted to be a doctor without borders, going to war areas to help people. And then he thought, maybe I can make a combination of this. And maybe I can go to war zones, conflict zones, and make music with community, with people, with children, and that's what he does. He went also to the Middle East. I tried to contact him lately. Did you go to Gaza or whatever? But he is going really to the war zones and things like. And then he is making music with children, also because he says sometimes in music you can tell your story and you cannot tell it in words. And then making music together creates an atmosphere that I have to say it's hopeful. I do not want to relate everything to hope, but yeah. And hope, it's important for me to say that hope is very, very different for me from optimism. It's not everything will be well, everything will come out well. That's not it. We have to work for it, and there are possibilities. And when you work for it, you probably will feel a bit better. But also so now everything is trauma, also in trauma treatment. I think in the future, if you want to give it the name of trauma, but most of the time for me, that's a too individual diagnosis. It's a very healthy reaction on terrible things that happen to you. And also there, I think, we need to create communities to do things together, to make music maybe. And there are so many projects. If you open your eyes for it, you can see many, many projects around in nature, in music, in art, and they're all always active, do things together.
The doing is interesting. The emphasis on doing and together, doing together. Because in the recent history of systemic therapy, we've moved from trying to understand the problems of an individual in the context, in particular of their family, and we've got stuck in some places. We challenge this concept of problem by saying the language is the problem, or the system is the problem, or the language in the system is the problem. But we still stayed in a consulting room, and we still stayed in language. When I say we, that's not true of everybody. But then when we talk, and you've been very involved in the dialogical practices group and conferences, but how would you like to see dialogical reframed? Do we need to dump the word because it sounds or is interpreted as being solely connected to language? Or do we need to talk more about collaborative practices? Do we need to give language a smaller place in the scheme of things? I don't know. What do you think in terms of your hopes for the future of what systemic practitioners can offer?
Well, there's not one way, I think, but we reduced language too much to verbal language and words, because we know that communication or language, you could also say, this is language. When I talk like it's also my body, my eyes, it's everything. And why do we say that language is words? So we can go either way, or we still say collaborative dialogues of dialogical collaborative practices or whatever. But the importance is that we realize that action, bodies, movement outside will be together, communities will be very hopeful. Hopefully they will be central in the future. I think so. So it's not, maybe we need to find a new word. I don't know, maybe. But it's not that. It's that we can imagine, that we can come forward in creating active communities working together, and how good it is. So what also came out of my research, that a lot of people are helped not by concentrating on what's happening inside, but by moving their concentration, their focus on things outside of me, and doing things together because it's important, instead of concentrating all the time.
Well, therapy invites, sort of traditional talking therapy invites you back into a story or problem. Now it should be moving forward into different concepts and so on. And I'm sure a lot of the time therapy helps people move so that they are not so attached to the same concepts, don't feel the need to go over things that are troubling. But there's still that inheritance from a colonial era of scientific medical thinking, the talking cure. And the talk has to happen with an expert. And the expert knows best about what they need to do. And systemic therapy's been through that, and the institutions we've worked in or get employed in sometimes, not in more communal, collaborative, collective, independent structures necessarily. But some of the ideas are about power structures, that therapy happens within power structures, as opposed to it being a community practice, something else without hierarchy, with more camaraderie or companionship, allyship, accompliship, whatever the words might be. So I'm just sort of wondering, what would be your vision if you were rewriting or writing a systemic training or consulting to practitioners right now who are designing a systemic training? What would you be encouraging them as practices of hope to design something? What would be a hopeful practice? And that might not be quite the right question, so feel free to
But
it.
I was thinking, what we found in Lorenzhuis, when we also have to relate to the context of the students that come to us. So if we are too revolutionary and bring them to something that is maybe magic, but they cannot bring it to the institution where they work, and they need to work there, they have their houses, their children, everything, I think it's not helpful. So we have to find a way to make the dance, to bring in new images, but in a way they can deal with. That's always the problem. I think that's a problem in teaching, that when you go too far, when the difference is too far away from their life, they will say, wow, but it's not helpful. And if you stay too close, nothing will happen. Well, we know that. So you need to relate to them in their context, their families, their institution, where they work, and also open up to other perspectives in a way they can deal with, and maybe also think with them, how can you bring this new perspective to where you work now? In what way? And of course, it's good to also to open up, to have this visionary idea about communities doing things together, actions, how important it is. I think we also have to talk about how important it is for us, for ourselves, to do that. So,
what sort of visionary things or practices of hope have been going on for you? What have been important, or what are important for you in this later stage of your life?
Well, I did. And so for me, it's not always communities. It's also be by myself. I need that. I also need to be alone. And when I'm too much in the community, I get totally exhausted. So I made a very long walking trip for 1.5 months. And it was from my house in Amsterdam to my house in Italy, through the Alps, and I'm very happy with my body, which is a good body, and I do not have any problems there. So I could do that, and it was it brought me more than I could think of, and also this feeling I will always find my way, also when there are big problems.
How many kilometers was it?
2,500. I don't know what it is in miles.
A lot.
It's a lot. Yeah. And it was really great to do it. From then on, I walk every day, and sometimes also I take time off for 3 weeks or so to do a long walk, because it's bringing me such a lot.
Would you recommend that people consider finding their own version of such an adventure? I think you told me that you did it. I don't know if you did it intentionally or you realized you needed to do it as a transitional thing. Can you?
Yeah. So it was a ritual for me to do it from a very busy life, because I longed for a more quiet life, and it happened. And I needed a transition ritual. Yeah. So, I don't know if I want to recommend, but I do that now also with friends and people around, to reflect with them what could be a transition ritual for you, because people come into therapy because they're longing for change. And it's not only words. Of course, words, another way of wording, can also create other worlds. But I love to reflect with people on what could be your ritual. It can be also very different from walking, but to do something with it. And actually, my doctorate also was a transition ritual.
Yes, your doctorate.
Yeah. Yeah. So I had 2 rituals. Yeah. Big ones.
Are there other people? Are there other events or happenings that you feel are important to map in this conversation for systemic lives? Yeah.
So many.
So many.
But one of the transitions for me was the Copenhagen All Women Conference, organized by the feminist movement, and with women from all over the world. I think that the American feminists organized it, and then there were from each country 3 women or so could come. From the Netherlands it was 2, because it depends on how big the country was. I was there.
Which year was that?
Yeah, I was thinking about that one. When was it? But must have been like maybe 85, something like that.
Yeah.
I can have a look. But it was with all the feminists, Virginia Goldner, Falikov, the whole group was there.
Was that the conference that, because I think Imelda McCarthy's told me about this conference, that it came about as a sort of critical response to the main EFTA conferences or family therapy conferences, where very few women were ever invited as keynotes. It was just very, very male-dominated.
Yeah, that's true. And then in that conference also we thought about strategies to get more women on the stage and how should we do it. And the next conference was in Amsterdam. And then I got into the scientific committee, and we made it a serious thing. There were as at least as many women on the stage as men, and we succeeded there. I had a big conflict also with men at that time from the field that felt we were very disrespectful.
Well, you were part of the change that needed to happen. That discourse was so intense. Entrenched, problematic women, feminists, people, well, it's still the case, isn't it, that people from either minority, marginalised, oppressed groups are seen as problematic when they ask for equality, demand it, speak in ways that, or do things together in ways that are not reflective of what's gone before.
So that was, and then I've also felt that resistance can be such a great joy. We had such a lot of laughter there in Copenhagen together. We danced, we had such a good time together. So it was powerful, doing things, planning. Yeah, it was a practice of hope and resistance and action together. Yeah, there it is again. Maybe I'm too much.
You've decided to write a little book out of your thesis.
Yeah.
And you've made a decision to write it in non-doctoral, traditional doctoral language.
Yeah.
I'm sure your thesis, I know it wasn't in, high academic, complex language, but you've made a decision to write a short book in Dutch for a mainstream publisher, so that there's something about practices of hope that are available for all. Can you just say a little bit about that?
It was a decision because actually I think most of the theses are big books, and you can print them and give them to other people, but they end on shelves and are they're not good read, most of them. So I thought, I'm not feeling like that. There's no print for my whole thesis, just one for myself, for my exam. And then I thought, well, but I maybe I can make a small book of it that is for much more people. It's now 130 pages, so it's a small book. And I think the essence is in it. And it's also because I want in the Netherlands people to create other images of doing research. And we will have a day, the 21st of November, in Amsterdam, in the Uilenburger Schule. And I love to do that. And I will make it a feast of research also.
Uh-huh.
I hope that people that come there, and I'm sure they will come, that to invite them, research is such a wonderful thing to do. And because the images are always you being on your own, struggling with all the references, struggling with all the statistics. That's the image still in the Netherlands around doing research. And you do it for your career, you have it to do it to make the next step, but not out of joy, not as a very enjoyable activity in your life. And so I also hope to bring that forward. And I think it's my last big thing I want to do in the Netherlands.
It's a wonderful thing, because you're right. There's still a big need for people to, especially for systemic practitioners or any kind of professional practitioner, to understand that first person knowing is so rich that we don't need to go and collect data out there. We have a lot of material, living stories, stuff we know. That's how our profession started, though, isn't it? with storytelling.
Yeah.
And trying to kind of discuss those stories, those experiences with others. And then they all fell away from the journals for many years with the evidence-based flat writing that came in. So this is you really trying to encourage people to hear themselves and value what it is they can bring, that they can share with others, that they can study. That's wonderful. What's the title of the book in Dutch?
Hope in Action, I think. Hope. Active hope.
And how do you put that in Dutch?
Yeah.
That was what I asked.
Sometimes when I speak English for a long time, I forget about my own language.
But that's
hope
good.
in actie. Hope in actie. Yeah.
Hope in actie and hope in action. So when there's an English version, that was my next question. What would it be called in English? So hopefully there'll be a translation at some point into English. That would be fantastic. Just as part of a kind of drawing things to a close, systemic, the world is in a really dangerous place. For some people, the danger is very immediate. For others, it's more insidious. It's just creeping in here and there and everywhere. Do systemic thinkers, practitioners have anything particular to offer? Could we be offering something, doing something? What's our role at the moment, do you think? Or what are your wishes for how we could use our systemic knowledge or ways of being?
I think we cannot not offer. Everything we do is political. That's what with me all my life. Everything you do is political. But we can use that more together and to see that the world is really a big worry at the moment for many people and animals and nature and everything. But we can use our voices more. We have to be brave together, and together you're more brave than on your own. Mm-hmm. And see, so this morning you read out loud for me the new manifesto coming from the field.
Yeah, the systemic manifesto.
Yeah, the systemic manifesto. I loved it. It is very political, and it's also, and I think maybe we need to do that kind of things, and not only within our own community, but reaching out to other communities. To see how we can reach out to other, because if we are in our own systemic bubble, it seems very obvious. We can say, oh, it's so important what we do, but it's only useful if we can also reach out to other communities and see how we can create action together.
Thank you. And Justine, are there any things that I haven't asked you or that we've missed en route that you want to mention, people or events or places? There's so much I know that will have been missed out, but is there anything in particular that you'd like to bring in?
Well, I if I look back, what I feel a bit disrespectful now to all the people that inspired me a lot, like Jim Franco Check-in was very important for me. Elsa Jones was very important for me. Virginia Goldner, the Ackerman women were very important for me.
Feel free to mention names. It's interesting. Mention some more names.
Yeah, so there were so many inspirational human beings that I talked to that stayed with me in my house also. Michael White, John Schotter, Peter Rober. I don't know. So from the systemic field, there has been such a lot of people that I really loved talking to, doing things with, also dance with, laugh with, make music with, all kind of things. It's not only the talking. I had a lot of fun with Jim Wilson, very important person in my professional life. So from the UK, from Italy, Maurizio Andolfi partly, but also, his focus on children. He was very good there for me. So, I want to pay respect to a lot of people that inspired me. And also in the Netherlands, Frans Boekhorst, Ellen Rijmers, Anke. There were a lot of people that were older that I stand on their shoulders to say, they inspired me. I went on. And now I am in the oldest generation. I can feel this whole stream, and I want to pay respect also. I couldn't be here when they have not been there. So it's going on.
Part of a systemic river.
Yeah.
Or something.
Yeah. And for me, it's good also to take rest now, to walk, to sit down, not always having to be active, doing things, saying yes. It's a good pace I'm in now.
Well, you've inspired a lot of people. You've taught a lot of people. And people have been very attracted to your politics, your ways of being, seeing. You've done a lot of writing and teaching and sharing. But just being around you, I'm sure, makes a big impact on people. I've seen that. Justine, thank you so much for joining me in this conversation today. It's been wonderful to have you as a conversational partner, guest on the Systemic Lives podcast. Thank you very much.
And thank you, Gail, because you have been one of my inspirational resources from the later years.
We are an inspiration to each other.
Yeah, thank you.
Hope you enjoyed the conversations as much as we have. Please get in touch and let us know what you liked, what resonated for you, and who else you might like to hear more from. Please feel free to share with others in your personal and professional network. Rate this show on your platform, and let's create our Systemic Lives community.